Team Clocks presents Smart on Fire application for existing clinical decision support system, or CDSS for short, for hospital discharge decision making. And for those of you wondering, we did not name our own team or project. My name is Zach Cole, and I'm speaking on behalf of my teammates Rob Reagan, Mian Ahmad, and Raymond Toscano. Most importantly, let's talk about the problem we're trying to solve. So, post-surgery, physicians have to make a judgment call on when to discharge a patient. This is what we call a Goldilocks problem, and we'll explain that in context. Discharging a patient too late occupies a bed and drives up medical costs, but discharging a patient too early can lead to complications and readmission, which is hard on the patient and drives up medical costs. The challenge here is trying to find an equilibrium, and while there are rules of thumb for when to discharge a patient, Dr. Cox and Dr. Sweeney thought there must be a better way. Thus, Dr. Cox and Dr. Sweeney wanted to develop a model for assisting surgeons and physicians in making discharge decisions. Their criteria for success are as follows. Decrease the 30-day unplanned readmission rate by a total of 10%, and also decrease the average length of the hospital stay. To create the model for this clinical decision support system, they pulled anonymized data from over 20,000 Emory patients and performed statistical analysis to see if there are other unrecognized variables that indicate when a patient can be discharged. In doing so, they found 30 variables that were significantly predictive for the discharge decision. To validate their model, it was then tested with in and out of sample data. A study was performed with fourth-year medical students and residents and found to be helpful. Now let's talk about the scope of our project. The underlying model for the CDSS software has already been developed. And by developed, I mean that the model has been backtested and described to us in a Microsoft PowerPoint slide deck. With that in mind, we need to do the following. Implement the model in code. Create a secure cloud-based web application to host the model. This will include an administrative console for managing logins, a patient query screen to look up a patient, and a visualization component to display the results of the model. Finally, fulfill Cerner's EHR integration requirements for third-party apps to allow interaction with patient data. What project would be complete without a little Fire? We'll use Fire for the following. In order to retrieve the variables needed for the model, we will have to interact with Cerner's EHR system via Fire. The variables that we need are stored as observations in Fire. And finally, there is still a need to have a physician map all of the various different types of observations into exactly what the model is looking for. For example, there are many different types of tests for potassium levels, and they're coded based on different systems. Finally, we're going to lay out our planned schedule of production for the project. Here you'll see the spreadsheet form. On the next slide, you're going to see the complementing Gantt chart. This is a lot of data, so feel free to pause the video and have a closer look. Thus concludes our presentation. Thank you for watching.